Welcome back. It is Medical Monday, and today we are joined by Dr. Kristoffer Wong, a board-certified bariatric surgeon at Hurley Comprehensive Weight Loss Clinic. He is here to talk about a new weight loss surgical procedure. Good morning to you.
Good morning.
Yeah,
thanks for having us.
Yeah, thanks for coming in. Let's talk about it. What is the name of this procedure? What are we learning about today?
It's called the SADS, or the SADI. It's an acronym for a single anastomosis duodenal ileostomy with sleeve gastrectomy.
All right, that's a lot of words, so let's put it in layman's terms for people. What does that mean, basically?
So we do a sleeve gastrectomy, which a lot of people have. About 75 to 80% of the people in the U.S. having weight loss surgery, that's what they're getting. And then beyond that, we do a bypass just beyond the stomach. We reroute the food, so it changes how the body absorbs fat and sugar. As you can see in this picture here, just beyond the pylorus, that's where we put the small intestines. And there's about 300 centimeters that we use for your body to absorb all that fat and sugar, which leads to more weight loss.
Well, talk about why this is a good option when it comes to having surgery.
So it really helps in patients who have type 2 diabetes. Immediately after having this surgical procedure, their blood sugars are under control, which helps with their hemoglobin A1C. But it also helps in patients who have elevated BMIs, or body mass indexes, for weight. So patients who are severely overweight, it allows more weight loss, and that leads to less medical problems, healthier, body type, and people just feeling better overall.
And why is this a better option compared to what else is out there?
This is a better option just because there's one anastomosis compared to the standard gastric bypass or the Roux-en-Y gastric bypass. What we're seeing is patients overall have less complications and better weight loss. Patients just feel better, which is the whole point, but have better outcomes long term.
And who's typically a good candidate for this procedure?
Definitely patients, as I said, who have type 2 diabetes. BMIs over 50 are great options. Patients who have elevated BMIs. And then patients looking for long-term weight loss, for years beyond. Not that the sleeve gastrectomy isn't a great surgery. Unfortunately, patients sometimes have weight regain after a few years. So these are patients that may have, high weight that they want to lose and keep off for a long period of time.
Well, and coming from your perspective there, talk about what you do there just overall at the surgical center and how you'll walk people through these options.
So we see everybody in the office for a consultation with the physician, the surgeon. They also meet with the dietitian and our insurance staff and talk about what is the right surgical procedure for them based on their medical comorbidities, their weight, and what they're looking for in terms of their weight loss goals. But also, with the dietitian nutritionist, we also offer a lot of other options that are non-surgical. So that is medical weight loss. In some patients, this thought of surgery is very scary. So, that is meeting with the dietitians, meeting with behavioral psychologists, and really kind of looking at weight loss in a non-surgical fashion. But also,
you'll formulate a plan, bottom line.
And then the other option is also, obviously, everybody hears about these medications, the GLP-1 medications that we also offer through Hurley, meeting with a nurse practitioner that helps regulate the dosage of the medication, and then also the side effects of the medications as well.
Well, it sounds like, bottom line, again, like you said, there's a team there to lead you in the right direction. Our thanks to Dr. Kristoffer Wong, a board-certified bariatric surgeon at Hurley Comprehensive Weight Loss Clinic. You can find more information by going to that website on your screen. Thank you so much for coming in.
Thank you.